Dermatology researchers at Henry Ford Health System, in collaboration with a team at the University of Michigan, have demonstrated that certain N95 respirators tainted with COVID-19 can be effectively and safely decontaminated for reuse using ultraviolet-C light (UVC), a method commonly utilized. Researchers say the outside and inside of the face masks were decontaminated in a prototype phototherapy unit that dispenses a UVC dosing level high enough to effectively kill the virus in less than 2 minutes while still preserving the face mask's breathability, fit and overall integrity. Of the 5 N95s used at Henry Ford and tested for the coronavirus in the study, the decontamination process worked best on 2 models, facepieces on 3M1860 and Moldex 1511 and straps on 3M8210 and Moldex 1511. The effects of the dosage varied on the other tested models and their straps, suggesting that the UVC radiation can degrade them. Researchers say wiping the straps with ethanol before decontamination would likely be required as an additional disinfection step in the process to maximize the wearer's safety. Researchers emphasize that fit testing be required each time a disinfected face mask is returned for use or a new model is being worn for the first time. The research, conducted in partnership with the University of Michigan, is published in the International Journal of Infectious Diseases. Our findings reveal a practical and viable option should hospitals encounter shortages of N95s in the future, says David Ozog, MD, chair of Henry Ford's Department of Dermatology in Detroit and the study's lead author. We were able to replicate that sterilization effectiveness with COVID-19. Ozog stressed that face mask sterilization should only be used in severe shortages of N95s. Testing of the N95s for decontamination was performed at UMU's SARS-CoV-2 Research Lab in Ann Arbor. The research culminated the work of a team of dermatologists and researchers who have devoted more than 400 hours since the pandemic hit Michigan to investigating how phototherapy, a type of medical treatment used for treating certain skin conditions, could serve a role in the global health epidemic. They examined the reliability of the prototype unit and ultraviolet light, the minimum dosage needed for decontamination, the importance of fit testing post-decontamination and 4 common methods associated with face mask decontamination. The pandemic exposed a critical flaw in the global PPE supply chain as the healthcare industry struggled to obtain supplies of N95s, other face mask types, gowns, gloves and face shields. As a result, decontaminating N95s to be reused safely became essential for many healthcare systems and providers until new shipments of supplies arrived. We desperately wanted to help our frontline workers, who were crushed with COVID-19 cases at Henry Ford, Dr. Ozog says. UVC is one of the 4 methods considered for face mask decontamination. It is well known for its ability to penetrate the DNA of bacteria and microorganisms and prevent them from multiplying or replicating. Previous research has shown UVC to be effective at killing the flu virus as well. 2 other well-known coronaviruses, severe acute respiratory syndrome (SARS-CoV) and Middle East respiratory syndrome (MERS-CoV). Whether it could work on the novel COVID-19 virus was previously unknown. Henry Ford's phototherapy unit was modified with the help of engineers at Davlin Co., a phototherapy manufacturer based in Bryan, Ohio. It sits on a flat surface and is about 5 feet long. The decontamination field measures 15 inches deep by 45 inches long, plenty room to treat up to 27 face masks at one time. The ultraviolet light is powered by at least 10 but not more than 20 UVC lamps. For the study, 5 types of N95s used at Henry Ford were tested at the UMBSL-3 Biosafety Lab. The respirators were contaminated with 4 drops of the COVID-19 virus taken from viral stocks obtained from the federal government's Biodefense and Emergency Infections Research Resources Repository. The virus droplets were placed in 4 areas: nosepiece, apex, chin and strap. The face masks were kept dry in a biosafety cabinet at room temperature for 40 minutes. Then they were moved to the phototherapy unit for decontamination using a dose of 1.5 J per square centimeter ultraviolet light radiation, at a wavelength of 254 nanometers, to each side of the mask for about 60 seconds. Ultraviolet radiation is measured in 3 wavelengths: UVC, UVB and UVA. UVB and UVA are associated with skin cancer and are also used in the treatment of some dermatologic diseases such as vitiligo and psoriasis. She says the curvature of the face mask and the distance between its surface and the lamps are crucial factors in achieving the proper dosage. LOD is the minimum concentration of a component that can be reliably detected. CPE means the virus yielded no infectious properties. All 5 facepieces had below LOD and no CPE, but some had traces of the virus on their straps, according to the research. Researchers cautioned that none of the N95s tested were visibly soiled. Most health systems including Henry Ford prohibit the reuse of soiled N95s. In a letter to the editor published in Photodermatology, Photoimmunology Photomedicine, Shanthi Nala, MD, a Henry Ford Dermatology Fellow, urged caution about using UVC decontamination due to the variety of N95s in use across the country. In a demonstration of the prototype unit, the face masks are placed on a stainless steel tray, separated by autoclave tape to keep them from touching each other. Once one side of the face mask is treated, it's flipped over to perform a separate decontamination. Researchers say any visibly soiled masks should not be treated but rather properly disposed as medical waste. Researchers stress that not all N95s are created equal and may not withstand decontamination. Degrading may occur in the face mask's outer surface and the elasticity of the bands. Thus, researchers underscored the importance of fit testing after decontamination in a study published in the Journal of the American Academy of Dermatology. Health-care workers are fit tested every year with their N95 to ensure a proper fit and no air can penetrate the outer edges. UVC is one of the 4 common methods used in healthcare to sterilize N95s. Hydrogen peroxide vaporization, microwave-generated steaming and dry heating also have shown to be effective in varying degrees. UVC and HPV are also commonly used for disinfecting patient care units, surgical suites and intensive care units in the healthcare setting. Only the UVC method was used in the Henry Ford study. Researchers strike a cautionary tone for N95 decontamination no matter the method. Please support my channel to grow by pressing subscribe button and the bell icon. We will notify you technological news. Thank you.